I'm glad to introduce Dr. Marc Atkins, who is here to tell us about his career path for SSEP's How Did I Get Here video series. Dr. Atkins received his PhD in clinical psychology from Florida State University. Dr. Atkins arrived at UIC in 1994 and developed and directed the psychology internship program in psychiatry. He is currently Professor of Psychiatry and Psychology and Director of the Institute for Juvenile Research at the University of Illinois at Chicago. You know what? Sorry, hold on a second. I'm glad to introduce Dr. Marc Atkins, who is here to tell us about his career path for SSEP's How Did I Get Here video series. Dr. Atkins received his PhD in clinical psychology from Florida State University. Dr. Atkins arrived at his current position at the University of Illinois at Chicago in 1994 and developed and directed the psychology internship program in psychiatry. He is currently Professor of Psychiatry and Psychology and Director of the Institute for Juvenile Research at UIC. He also directs the Dissemination and Implementation Research and Policy Program for UIC's Center for Clinical and Translational Research. Dr. Atkins is an active researcher and recipient of several grants from the NIMH and private foundations in the areas of childhood ADHD and aggression, and community mental health services for children and families living in high poverty urban communities. He's a frequent consultant to the Chicago Public Schools, as well as the Illinois Division of Mental Health and the Illinois State Board of Education on guidelines for school and community-based mental health programs and practices. He serves on 2 national boards as Secretary of the Academy of Psychological Clinical Science of the Association for Psychological Science, and is past president of the Society for Clinical Child and Adolescent Psychology, Division 53, of the American Psychological Association. Dr. Atkins, please describe your career path and tell us about any obstacles or barriers that you overcame along the way. In addition, tell us what has surprised you about your job and what you wish you had known earlier about this type of position.
Well, I'm very happy to do this, and thank you for inviting me. So in thinking about my career path, and I always think about that I was once on a panel of 13 mentors, and each of us was asked to talk about our career path, and each of us started by saying my career path was somewhat unusual. And so I think I'm like everyone else. I do think my career path was unusual. So I think what was a little bit different for me was that I dropped out of college twice. Once because I was having some problems and in my freshman year and really couldn't cope. And then when I got back to school, I really wasn't into it. So I dropped out again. And at that point, I decided what I really liked doing was working with kids. So I just started doing that. I was working in Head Start centers. I got a job. I was in California. I was in Davis, California, because that's what kids from New York did back then, as we went to California. And I did. And I got a job at a daycare center. And so I was a teacher at a daycare center. I was there about 3 or 4 years. You know, I really liked it. I really liked kids, and I figured that was something that I could do. Of course, didn't pay very much, but there was a school psychologist who was consulting. She was the head of the psychology. This daycare center was part of the school district in Davis, California, and she was the head of psychology for the district, and she was consulting. And she sort of started mentoring me and encouraged me to get back to school. So I went to UC Davis and worked with her, basically. I wrote my own major, being a very independently minded person. And I did a lot more stuff with kids, got my degree, and then did what I do. I did more stuff with kids. So there I was. I started working in residential treatment centers and did that for 3 or 4 years in San Francisco. And by the time now I'm in my mid to late 20s, and I've got 7, 8 years experience working with kids, and I feel like I really know that well. At that point, I started thinking about grad school. And the people at the residential treatment setting were all social workers, and they convinced me that that's really what I needed to do. So I applied and got into UC Berkeley School of Social Work. But at the last minute said, you know what? I really thought psychology was for me. And I found out, much to my horror, that psychology was about research. So I said, wow, I better do something about that, because I wrote my own major and I didn't have any stats, and I was just doing what I wanted to do, I suppose. So I applied to a bunch of master's programs, got into several, and I chose the one at University of Kansas in applied behavior analysis, where they shaped me to be a behaviorist and taught me a lot about data analysis. And it was single subject data analysis, but really, I think at that point, I kind of realized that this was really fun. This is something I really enjoyed. I really liked. I thought it enhanced my work with kids. I was now starting to understand what was going on. At that point, I applied to doctoral programs and got into Florida State's program, and I worked with Bill Pelham there. So, that in and of itself, I think, is somewhat unusual. What happened in grad school was Bill is a leading ADHD researcher, and so I was hanging out in schools because that's where ADHD kids have problems. And I found that I was very comfortable working in those settings, and I was very uncomfortable working in clinics. And might have dated back to my own issues and so on. I just never did like being in a clinic and a hospital. I find them artificial settings. I think that 7 or 8 years working with kids in kind of natural settings of schools and even in the residential treatment, I was working in a school and I was living with the kids at night. And I think that really informed my thinking in grad school and after. And I've since been very drawn towards these natural settings. And I think that's been where my work has progressed the most, is thinking about how kids are doing in the natural environments, much less about what we do with them in clinics. I just don't think that clinics, hospitals, and places like that are particularly good places for kids to hang out. I'd rather they be out in schools and community settings and so on. So that's what I wind up doing. And in terms of my current position, my first position, I've been in, I think one of the big surprises to me is I've been in medical schools my whole career. My first position was at the Medical College of Pennsylvania. And after 4 years, I then moved to the University of Pennsylvania and worked at the Children's Hospital of Philadelphia for about 5 years. And then I moved here. And the way I got here was that there was a position open for a training director, and I had been doing work on internships since the beginning of my career, and actually was directing the internship at CHOP for a couple of years. So I applied and looked like a good setting for me, and so I've been here ever since. And I've often thought about the fact that I was trained in a psychology department, and I was trained to be a clinical psychology professor. That's really what I thought I was going to be. And I now have an affiliation, and have had for several years now, but in our psychology program here, and have grad students and all. But it's a different environment than I thought I'd be in. One of the things that I find when I think about it and when I talk with my colleagues is that I think it reflects the reason I think it works for me is it's a setting where I can be very independent and entrepreneurial, and that's been the grant writing and so on, developing programs that interest me. And I don't, I think, look like a psychology professor very much. I don't know that I fit too well in a psychology department. Maybe some, I'm not sure anymore, but I don't think about it too much. But one of the things that I think has been the biggest surprise for me being in the settings that I'm in is the importance of administrative skills. And that's certainly, grant writing and administrative skills are the two things I had no idea I'd be doing in grad school. And I really didn't get very much prep for that. The one thing I did in grad school, which was mostly a function of my stubbornness, was I was very independent. And Bill Pelham allowed that and even encouraged that. And so I didn't publish a lot in grad school, but I had lots of data, and they were data that I collected, and I just had a lot of sense of control, and I think that has helped me when I've moved into these positions where it's expected that I develop my own program of research. I think I was probably a little better prepared than some others might have been coming out of grad school, because I kind of felt like I developed that research program that I did for my dissertation, and it was a very intensive dissertation with lots of observations and lots of things going on that required, several years of work and managing a staff and that kind of thing. So the administrative stuff kind of caught me by surprise when I became an internship director, and I started recognizing that, especially at these medical centers, I can't speak to psychology departments too well, but especially at the medical centers, being a what you call triple threat, having clinical skills, research skills, and administrative skills comes in handy, and it's allowed me to take on new positions. And now last year I've been directing the institute here. And with a new set of challenges and tests of my administrative skills. So, yeah, so I think I'll stop there.
Thank you so much, Dr. Atkins.
Very welcome.